this on? You guys hear me okay? I was just going to ask, where's Angela? Can she give us a let's go? There it is. Before Jeff shares real quickly, I just wanted to acknowledge all of you for bringing the energy after lunch. That's fantastic.
Whoa. Thanks, Nick, for that invitation. And this is something I've never done before. Monday, I was sitting in Steve Hardison's office talking about this conversation that we're going to be having today. And among other things, he said, I can visualize it. I can see you and Corey standing there in scrubs. And I said, wow, problem. I didn't bring any scrubs, and I'm flying straight from here to Birmingham. And Steve says, it's not a problem unless there's a solution. Go buy some scrubs. So, bought some scrubs, and then I thought, wow, it would be fantastic to have these things embroidered. So it's 1 o'clock, I'm at the scrub store, and I'm like, hey, how can I get these embroidered today? And they just laughed at me. So I got on my phone and I started looking up, and I called this custom embroidery shop. Nobody answered. Well, I'm just going to go there. So I went there, and there was a sign out front, really a beautiful sign about serving others and about creating miracles. And I'm like so excited. It's Monday, and I go in the store, and I said, wow, I really like your sign out front. And the lady said, wow, thank you. How are you today? I said, well, it's Miraculous Monday. You want to help me create a miracle? And she said, I don't know. What do you have in mind? Well, I got this friend named Matt Evans, and he's got a beautiful family, and his little girl was served by the Birmingham Children's Hospital with a cochlear implant so she can be here and hear what we're saying today. And Corey, my partner, and I are going over there for an event he's putting on, and we're talking about being in medicine, and I would really serve us to have embroidered scrubs at the event. And she looked and she says, you know, this would normally take 2 weeks, and I got a full day. I'm already dealing with another emergency, but I'll make it happen. I'll work it out. I close in 3 hours. Come back. So I come back, and she produced it for us. So excited. I brought her a book, enrolled her in reading the book. She's excited to read the book, right? And so I give her a big hug, and I go to pay her, and she goes, no, I'm not going to take any money from you today. We can't do much, but this is what we have to offer for this event.
It's a great miracle. I want to make an acknowledgement first. Is Elizabeth Adams in the room? I saw her earlier, wherever she is. Stand up, there she is. I want to acknowledge her for creating and getting us here today. You're a big part of that, so thank you. I also want to acknowledge Matt and his team for seeing the possibility in this talk and creating this time for us, because we weren't originally on the schedule until not too long ago. So thank you, Matt, and the team for doing that. And so Jeff and I, if you listen to our intros, we've been in medicine for many years, and all of those years are made up by a lot of moments. And you've heard that today already, moments. And so there's been some really good moments, and there's some bad, sad moments, as you can imagine, in medicine. And so I want to share with you a moment of mine. You see, 5 years ago, my 2-year-old daughter developed an infection on her face. And she's a tough little girl, very rambunctious. And being in medicine, my wife and I is also in medicine, we recognized the signs and symptoms right away. And we did our thing, and we took her to the doctor. We got the antibiotics. And as parents, we dutifully and continue to give her antibiotics. And after about 3 days, we realized that the antibiotics aren't working and the infection's starting to spread. And we made a decision to take her to the hospital. Maybe you've been into a hospital. And there's a flurry of activity. And for a 2-year-old, it's pretty scary, right? Needles come out, blood starts getting drawn, IVs start getting inserted, fluids are being pumped, and antibiotics are being pushed into our little 2-year-old daughter. And so we settled into the hospital to start treating this infection. And my wife and I had to show up for her, right? Show up in a way of love and caring and hope and just support, and also as her advocate, right? But we also had to show up for our other daughter, our 5-year-old, right? And be there for her in the way she needed us to be. And so we set course with the antibiotics. Day 1, continue. Day 2, no change. Infection starting to get worse. Day 3, still not improving. Let's change course. More tests, more blood work. And on day 4, again, the infection is now starting to spread into her throat, into her neck. And on day 4, being in medicine, risks, complications start to just flood your mind, right? What if this infection spreads to her body and she begins to get septic and her little organs can't keep up, right? The infection was in her mouth and in her throat, in her neck. What if it spreads and she can't keep an airway and breathe? And so we started having these conversations. And all of a sudden, just decision after decision after decision had to start being made, right? What antibiotics do we use? What meds do we use? What do we do to keep her comfortable? Who do we consult? Is it infectious disease? Is it the hospitalist? Is it surgery? Is it ear, nose, and throat? Who is it? Decision after decision leading to the next thing. And in that moment of decisions, as a parent, right? You want the most smartest, most knowledgeable, most experienced team to come in and surround your kid, right? But when you look into their eyes and you see concern and fear, and right? You remember that you also want compassionate, kind, and caring people to come in and surround your kids, right? You want them both, right? And so we continued course and we consulted all those people, by the way. And after a week of antibiotics and tests, that little girl started to clear the infection. And she fought and fought and fought. And that little spirit of hers came back to us. And she is now a thriving, fun-loving 7-year-old who just loves to give hugs. And we're very grateful for that. And so that's a moment in medicine that intersected with my life, right? And if we went around the room, I could probably ask you for a moment where medicine came and intersected with your life, right? And if you grant me this, I would ask you to just close your eyes for a moment. Close your eyes. Go back to that moment where medicine was intersecting with your life. Draw in the thoughts, the feelings, the experience that you had in that moment. Just bring it forward. Let it sit with you for a minute. And now I want to ask you to open your eyes and come back to this moment. Okay? Come back to this moment. And I want you to listen to what we're going to share to you from that place of experiencing medicine from that moment. And I want you to listen to what we're going to share with you about being in medicine. Because last week I saw a headline that really caught me off guard. Can you guys put up the first slide for me, please? And that headline, no, this is not it. Thank you, Fiona. I love this. And in our talk, you were going to see that. No, there's a different one. It's a headline. There it is. Most physicians would not recommend a career in medicine. And if you go on to read, it's actually 60% of physicians would not recommend a career in medicine. 60%. So the people whose knowledge, experience, and care that we need in our lowest time of need would not recommend that others show up for you. So that had Jeff and I wondering, what is the default future of medicine? We've been on a collision course with burnout, frustration, mental illness, and bad outcomes. And none of us who practice medicine went into medicine for bad outcomes. Not for ourselves and not for our patients. I went into medicine for my purpose of serving others, caring for others, and to heal others. And so my question to you is, who are we going to be today, right now, in this room, that can change the course of medicine? And I want you to be present. And I'm going to request that you be present while we share our experience and listen for that opening that you hear where you can be a part of changing the course of medicine. So Jeff is going to share with us why he got into medicine, and that's a powerful story as well.
Well, not for this. I had another career, and I answered the calling to use my gifts and my interests to serve and make a difference in the world. And everyone in this room, I acknowledge you for your fierce listening, and every one of you is being in medicine. So when I decided to make the shift, I went back to college. I had to do 2 years of undergraduate before I could even go to medical school, plus residency. I spent 11 years becoming skilled to do hip and knee replacement. Moved to Rapid City, been doing that for 22 years now. And around 5 or so years ago, Corey and I got together and started developing something, a hip and knee center of excellence. And it was really just the two of us doing our own thing, calling it forth without any titles or remuneration. As it picked up steam, gathered momentum, the other 7 surgical teams in our hospital who do hip and knee replacements joined forces, and we sat down and started looking at things like, for example, our implant formulary. Implants, that's the metal and plastic that you put in a hip or a knee when you do a knee replacement. And ultimately, we decided to shift from one vendor to a different vendor. And we had a guy on the old team, the old vendor, who was just a fantastic teammate. So I sat down with him one-on-one and I said, look, I want you to hear it directly from me. We're switching vendors. And you're such an important part of our team, I really wouldn't want to lose you. Let's work together to create you on this new team somehow or another. And he got real emotional, looked me in the eye and said, look, Marzi, I don't want to do this anymore. I show up to the operating room, I don't want to mess up. It wasn't mess, it was an F word. I'm not going to say it because Steve's keeping count. I don't want to mess up. I don't want to open the wrong box. I don't want to be partway through a case and find out we don't have what you need. I don't want to make you mad. I don't want to harm the patient. And I heard what he said. Now, ultimately, he's gone on. He still works with us in another capacity. But what I found in myself is I was also playing that same game. Do you have that slide up or that slide available? Indoctrination.
No.
Yeah, well, indoctrination. I found out that I was living my default document in medicine being indoctrinated. Now, when I say that, I like the word doc in the middle of that. Get that pun there? When I say that, it might sound like somebody did it to me, and I don't mean somebody did it to me. These were the thoughts and ideas that I attached to. I showed up playing not to lose. Like I'd spend more time talking with a patient about what might go wrong than what's probably going to go right. I'd do my charts and dot every I, cross every T, not because I cared how great my charts looked. I just didn't want to get in trouble. I didn't want to get audited. God forbid, I didn't want to get sued, and I certainly didn't want to harm a patient. I mean, in medicine, there's like zero tolerance for mistakes. Very stressful set of circumstances. And let me show you what it looks like when you're playing not to lose. I'm in clinic, I got a guy I did a hip replacement on about a month ago. He's walking in, and I see him walking in. You can't even tell he had surgery. He's walking fantastically. I examined him, his incision's perfect, his strength is perfect. I look at his x-ray, they could be on the cover of an arthroplasty journal. And I'm like, I'm jazzed. And he's not jazzed. I'm like, what's going on? Well, Dr. Mars, I'd want you to know that, first of all, I'm actually satisfied with my hip replacement. But I don't think I had a good experience. Well, what do you mean by that? Well, I don't feel like you and I created the kind of relationship that I would want to have with a person who's going to cut my body open. And I had a couple of things pop up, and I didn't feel like they were attended to the way I would want to have them attended to. And I heard what he said. And at a similar point in time, I had seen this TED Talk about the placebo effect. Now, y'all know what the placebo effect is. You give somebody a sugar pill, and they get better anyway. You do a sham treatment, and they get better anyway. Like, how is that happening? Well, in the study, what they found was that if the healthcare provider looks like they're being competent and looks compassionate, it creates an upgrade, a placebo effect. And I'm like, okay, well, if you can create something from nothing, maybe you could create something from something. What if we implement that in our hip and knee practice? So we created this formula, and I'd really like this slide to be up because this is the most powerful formula in the history of the universe. Do we have that slide? That's not it. It's a great picture, though. Okay, well, there it is. Has anybody ever seen this formula before?
Foreshadowing. That was a foreshadow.
That's foreshadow. Yeah, that's great. E equals MC squared. Well, in medicine, what that means for us is the experience is equal to the mission times compassion times competence. So we created the construct in language, E equals MC squared, and really lived into it. Like whenever a question would come along, should we do this surgery or that surgery? Should we postpone this surgery? Is it safe to do surgery? Whatever, would look at it through the twin lenses of compassion and competence. Would this look to the patient like compassion and competence? Yes, well, there's our answer. No, okay, let's find a different answer. So this construct was created in language. Corey, tell us more about how we created a foundation in language.
Sounds good. So everyone remembers Fiona's slide that was up here a minute ago, right? The being, the thoughts, action, the outcome. So what I'm going to share with you here in the next few minutes is more around those actions, right? A lot of those actions, which were generated from our being. And so powerful language is something that we needed to introduce into our hospital, right? E equals MC squared wasn't just like a position to take. It was a place to come from, right? And we wanted to transform our hospital into this. And so we began by creating an opening with our administrators to start having conversations about our mission, vision, and values at the hospital. And we created the possibility for them to see an opening for what conversations about values and living into our values would have on the culture of our hospital. And so Jeff and I started hosting culture conversations for our physicians, managers, executives, all team members. And they came and they talked and they shared with us. And that culture conversation was an opportunity for us to introduce powerful language. We began to speak powerful language into our hospital. We started to introduce terms, and you guys all read them because you've read the book, right? Integrity, commitment, right? Intention, love, and being. And so now in our hospital, whether you're talking to the CEO, the housekeepers, the nurses, the surgical team, it's common to hear intention, commitment, being, and love as part of those conversations, right? And it was important that we did that so that we could start to transform the experience of medicine for our physicians and our team members. And so we began to introduce this powerful language. And it began to catch on and build and build and build. And that's what we see today, is the transformation that started was something that we created in language, but ultimately was coming from our being, E equals MC squared.
Yeah, being E equals MC squared. So I was in the surgeon's lounge and I was talking to one of our partners, Dr. Lang. He's a hand surgeon, but when he came to Rapid City, it was a long time ago. He's recently retired. This was back in the day where they did everything. So a hand guy would do joints, or a hand guy might do some spine. So I'm telling him, hey, I'm going to give a talk to some of the advanced practitioners here in town, and I'm talking about patient experience. And I told him the story about my patient who had not a great experience despite a great objective outcome. And I told him about E equals MC squared. And he goes, hey, Marzi, let me tell you about the very last knee replacement I ever did. So he had a patient with rheumatoid arthritis. He got in there, the bone was soft, it crumbled in his hands, and he basically had to use revision components for her knee replacement. Revision components, that's like if somebody had a knee replacement, had been in for a long time, failed, and we had to take that out and put in new parts longer, further, deeper. In other words, it's really complex. That's what he did, and he said it came out looking pretty good. Unfortunately, it got infected, and he did all the stuff. He washed it out, but ultimately he had to amputate her leg above the knee. So there she is in the hospital. She just lost her leg. She had the worst objective outcome that you could imagine from a knee replacement. And he said, you know what the last thing she said to me in the hospital was? She looked me in the eye and said, thank you, Dr. Lang. And that's when the light bulb went off for me. Yeah, Dr. Lang, that's because you were being compassion. You were being competent. Since that's when E equals MC squared, for me, went from black and white two-dimensional to colorful 3 dimensions. Thank you, Matt, for that great slide. So incorporated E equals MC squared as a way of being. As an example, I'll just give you one brief example in the operating room. So say you came to observe a knee replacement and you were in my OR And what you would see happening, before we made an incision, we do a timeout. Now a timeout, there's other words for it, a surgical pause, maybe something else in UK, I don't know. But there's a World Health Organization directive. And what we do, before we make an incision, everything stops. There's no music, there's no talking, there's nothing in the hands. Everybody's attentive and fiercely listening. And we identify the patient by their wristband. We confirm the procedure by the consent. We confirm the location, like left knee, from the surgeon having marked it. And that's basically, it's a checklist. If you're going to fly an airplane, you want to make sure everything's functional before you fly the airplane. Only in my OR, we do it differently. We see the end from the beginning. We state, instead of, we're here to do Mrs. Jones' left knee replacement, we say, we're here as a team committed to doing what's necessary to create the most incredible experience possible for Mrs. Jones with her left knee replacement. And then I might say to the team, now how are we going to do that? And they'll say, by being compassionate and by being competent. So now this might sound, if you were a surgeon, what I'm saying to you would sound a little woo-woo, like nobody does this, right? It's risky, it sounds egotistical, it's gonna spin my partners up. So how do I do that? Well, it's a creation just like everything else. It's a created way of being. It's part of my document. I am my word, and my word is solid gold. I speak creation. The other day we had a guy in the OR with us. He's a rep for a new product we're using, and he witnessed all this, and he talked to me about it later. And the next day he sent me a text. He said, hey, Dr. Mars, it was great working with you in the OR yesterday. Can't wait to see you again in 2 weeks. And you can count on me showing up as compassion and being competence. So if you witness this in the room, what you will see is my team is joyful about the experience we're producing. And we're being E equals MC squared. We are playing to win, not playing not to lose.
So Jeff and I are intentional about our being in medicine. And those that interact with us can feel that shift in that experience. And so we wanted to serve more powerfully in the hospital. And so we set the intention and made the commitment to be in action around that. And I want to share with you real briefly just a couple of things that we did about that, okay? So the first thing that we did is we started to create the space to bring all of our team members together, everybody across the hospital, to come into a room and talk about being in the domains of what I mentioned earlier: integrity, intention, agreements, love, being, all those things. We created the space for that, and we enrolled them into what we call the ambassador program. So they'll be ambassadors for our hospital. And this is totally voluntary. And out of 350 employees that we have at the hospital, we have 110 participants in this program about being. Yeah. And next month, I'm happy to say, we are graduating our first class of ambassadors. And these people are going to go out into their workplace being who they are. But not only that, they're going to take their being with them everywhere they go, right? Home and into the community. And so we're really happy about that. The second thing that we did is we also created in a different kind of space. We started to create masterminds, groups of people within a domain that we could get together and talk about being. And so we created two domains. One is for our physicians, our physician mastermind. It's really for those practicing medicine, because physicians these days, right, they are accustomed to being in stressful environments, right? In a situation where there's very small room for error, right? And they constantly face that burnout and that stress. And we wanted to create the space for them to come together and talk about who they are showing up as providers, as physicians, and what that looks like for them. And the other mastermind that we created was for our managers and our supervisors and our executive team. And it's for them to come in and to explore being as leaders, right? We wanted to shift their mindset from managing people, because everybody knows how people love to be managed, right? To a mindset of managing processes and leading people. And so we began to shift that mindset for them, and we created those two masterminds, because it's important that we did that for our physicians and our team members. But it's also important because it is critical for our patients. And so we do enroll our patients in being.
Yeah, enrolling the patient is the critical factor. So let me tell you a story. 9 days ago, I go into my clinic space to see a patient who had a worn out hip. I walk in the room, I never met him before, and he's got a bad hip, like really, really, really bad. He's miserable walking, he's miserable sitting, he's miserable in bed, he can't get comfortable, he wants his hip replaced. This is a very special patient. I mean, they're all special, but he's special in a unique way. Effectively, he has no hands and he has no feet. When I asked him about it, he told me he was born with a birth defect. I don't really actually even understand it, but if you look, he's got forearms, and he's got these tiny little digit tips right at the end of his forearms. He can't grip or he can't really do anything, and he had mangled feet, so he had those amputated. He wears bilateral prostheses on both legs. Now, despite that, this guy is a Superman. In the room with him is his wife and 2 of his 5 children. These 2 boys are elementary school age, and they're just climbing all over, loving on him. And he's telling me he just wants to get back on the basketball court with him. He's got almost 30 years in the FAA. He likes to work on cars, go to air shows, climb in and out of airplanes. Despite all this, he played football in high school. So it's a big deal, right? And thank you, Chris Smith, for this language. If you haven't heard Chris and the recent Ultimate Coach podcast, I encourage you to listen for the humble heart surgeon. Gave me access to language which allows me to look this patient in the eye and say, look, we both recognize this is a high-stakes surgery, and I can see that you're nervous, and that's normal, but here's what I want you to know who I am. I am really good at what I do, and I am committed to taking good care of you. And my whole team is really good at what we do, and we're committed to taking good care of you. And what I'm asking of you is that you show up with that same level of commitment. Get yourself ready for surgery. Come in with the right mindset. Do your physical therapy. Help us manage your discomfort. Follow your hip positional precautions so you don't dislocate your hip. And he committed. I heard from his voice that level of commitment. And when we have that level of commitment with every member on the team, including the patient, that was a miracle that's already happened. It just hasn't become physical reality yet.
All right, I got one more slide. If you could put up the triangle slide, please. This one, right here. Providers, team members, and patients. No matter who you are in this room, medicine is going to, or maybe has, intersected with your life. And you will find yourself somewhere in here. Maybe you're a physician, maybe you're a nurse, maybe you're a team member, right? But you're somewhere in here. And so I started out by asking you, who are we going to be today in the room to change the future of medicine? I hope that you have seen an opening for where you fit into this triangle. Because whether you are a physician and you can show up for your patient and enroll them and get them committed, or if you're a team member and just by being love for the patients, you'll have that impact. But perhaps you are the patient. Or you're the father or the daughter, or the father or the mother, or the son or the daughter of a patient. Everyone in here has some place on this triangle, right? And so we want to change the course of medicine. We don't want those 60% of those physicians not to recommend showing up for you anymore. We want to change that. We're committed to that. And so I call to you to be in action, right? This is on the slide, right? Be in action. Be in action, right? So we're here today with being, but we're also here to support an organization, Birmingham Children's Hospital, right? So I call you to action to share your abundance with them. I went over there yesterday and took a tour, and they have amazing people, and they have a mission with the people who are compassionate and competent, and they're changing lives. Just as Matt can attest to, and his family, right? So be in action to give your abundance to the Birmingham Children's Hospital, okay? The second action that I'm asking you to participate in and to be in action around is to join the movement. Join the Being in Medicine movement. We started a Facebook page. I don't know if they have it, if they could pull that slide up. And you can join the group. And I'm asking you to get others and send the invitation to join the group so that they can learn about being in medicine and how they can create action in their own lives around being in medicine. And so I'd love you to get involved in that way and be in action around that. And so I hope that you listen to us from that point of experiencing medicine, and that you can take something with you from our experience. Because we shared with you a lot of our doings from our being. But what do we talk about every day, right? Is that, or even today, is that this starts with you, right? It starts with you. So I want to thank you very much for letting us come. I know we're probably over. So I appreciate it. Thank you. Have a wonderful day.